Did you know that unexplained itching in certain areas of your body could be an early, silent warning sign of cancer? Most people tend to dismiss a little itch here or there, but for older adults, especially those over 60, itchiness in specific recurring spots might be more than just dry skin or irritation. It could be your body quietly alerting you to something much more serious. In this video, we'll explore 5 distinct areas on the body where persistent itching could be an early signal of cancer, sometimes surfacing months before any other noticeable symptoms appear. These aren't random irritations. They're patterns that doctors have observed repeatedly in patients who were later diagnosed with serious conditions like lymphoma, pancreatic cancer, and even breast or skin cancer. Stick with me to the end, not just for a list of body parts, but to understand the deeper why behind each one. You'll learn what makes these specific itches different, what types of cancers they've been linked to, and how to distinguish a passing skin issue from something that warrants medical attention. By the end, you'll know what to watch for, what to ask your doctor, and what steps to take if these signs sound familiar. Most importantly, this isn't about panic. It's about awareness. The earlier you notice these quiet signals, the greater your chance of addressing a problem before it becomes harder to treat. Let's begin. Sign 1. Persistent itching on the lower legs. When older adults experience a persistent itch on the lower legs, especially the shins and calves, and there's no rash, no dryness, and no new soap or lotion to blame, it's easy to chalk it up to aging skin. But this particular symptom has shown up quietly and consistently in many people later diagnosed with blood-related cancers, especially lymphoma. This itch doesn't come and go. It lingers. It often worsens at night, and it doesn't respond to moisturizers the way ordinary dry skin would. The reason? Cancers like Hodgkin's lymphoma interfere with the immune system. These cancers develop in the lymphatic system, an essential part of your body's defense network. As cancer cells multiply, they release inflammatory chemicals into the bloodstream, and one of their earliest effects can be a deep, burning itch, often in the lower limbs. The skin may look normal on the surface, but the nerves underneath are being irritated from within. Consider the case of George, age 75, who shared his experience during a cancer awareness event. For 6 months, his only symptom was a relentless itch on the front of his legs. His doctor initially suspected eczema or detergent sensitivity. But when blood tests showed elevated white blood cell counts and scans revealed swollen lymph nodes in his chest, the real diagnosis became clear. The itch came first, George recalled, long before anything else. Stories like his aren't uncommon. Of course, not every itchy leg means cancer, but there's an important difference: how the skin reacts or doesn't. If there's no rash, no bug bites, no new product, and it's been going on for weeks, it's time to look closer. Especially if you also have night sweats, fatigue, or unexplained weight loss. This kind of body awareness becomes even more important with age. As we grow older, our bodies often send subtler distress signals. Pain might not show up immediately. Lumps may be too deep to feel. But your nerves still respond. And an itch, especially one that's deep, persistent, and unrelenting, may be their first alert. If you or someone close to you has been scratching their legs night after night, applying creams that don't help, and wondering why nothing's working, don't ignore it. Talk to a doctor. Request blood work. Describe the pattern. Because often, the body whispers long before it shouts, and listening could make all the difference. Sign 2. Itching. Between the shoulder blades or upper back. There's a specific kind of itch that shows up deep in the upper back, right between the shoulder blades, that's often ignored or blamed on posture, dry air, or even an old shirt tag. But for many older adults, persistent itching in this exact area, especially when it feels like it's coming from under the skin, has been linked to pancreatic cancer. And the strange thing is, it often appears months before any noticeable pain or digestive symptoms do. The connection might seem odd at first. How could an internal organ like the pancreas cause itchiness way up on the back? But here's how it works. When pancreatic tumors begin to grow, they can obstruct the bile ducts, those small tubes that help drain bile from the liver into the intestines. When this drainage slows or stops, bile salts start to accumulate in the bloodstream. One of the first things those excess bile salts do is irritate nerve endings, often in areas like the back, where the body stores a dense network of sensory nerves. I remember a woman named Linda, 70, who told me she had what she called a phantom itch on her upper back. She'd wake up scratching it every night. Nothing helped. Lotions, back scratchers, even changing her mattress. She said it felt like it was coming from the inside. When she went in for blood work for unrelated fatigue, her liver enzymes came back elevated. That led to imaging scans, and eventually, they found a small tumor in her pancreas pressing on the bile duct. The scary part? That itch was her only real symptom. No pain, no yellowing skin, just a deep, nagging sensation she couldn't shake. And the only reason she caught it early was because she spoke up, even when it felt like a small complaint. This is why that specific area matters. General back itchiness can come from dryness, pressure, or friction. But if the itch is focused, unrelenting, and doesn't improve with skin treatments, especially if you also notice darker urine, pale stools, or fatigue, it may be a deeper sign of something happening internally. The back becomes the messenger, even when the problem is in the gut. For older adults, these kinds of subtle symptoms are easy to dismiss. We don't always want to sound dramatic, but your body is wiser than you think. And when it sends you the same signal again and again, it's worth listening, even if it's just an itch. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Sign 3. Itchy scalp without visible flakes or dandruff. An itchy scalp might not sound like a big deal. In fact, for many older adults, it's easy to chalk up to dry air, aging skin, or a shampoo that doesn't quite agree. But when the itching becomes persistent, especially when there's no dandruff, redness, or flaking, it can sometimes be an early sign of something deeper happening beneath the surface, including blood-related cancers like leukemia or skin cancers affecting the scalp. What makes this itch different is that it tends to feel more like a tingling, crawling, or burning sensation than just dryness. It may move around from one spot to another, and it often doesn't respond to typical treatments like anti-dandruff shampoos or moisturizing scalp oils. For people over 60, these kinds of sensations can indicate nerve irritation triggered by abnormal immune activity, something that occurs when leukemia cells begin to multiply in the blood and affect how the body regulates inflammation. There was a man named Henry, 73, who mentioned that his scalp had started itching every afternoon. He tried changing hair products, then thought maybe his hat was the issue. But even after switching shampoos and going hat-free, the itch remained. When he eventually got a full blood panel done for unrelated fatigue, doctors found abnormally high white blood cell counts. A bone marrow biopsy confirmed early-stage chronic lymphocytic leukemia. His scalp had been the first and only part of his body alerting him. What makes this especially important is that many older adults already experience some level of dryness or skin sensitivity. So when something like an itchy scalp starts to feel just normal, it gets ignored. But what sets cancer-related itch apart is how resistant it is. No cream helps, no product soothes it. It lingers, nags, and often feels disconnected from any surface problem. And while leukemia isn't the only concern, skin cancers that develop on the scalp, especially in areas with thinning hair, can begin as nothing more than a small itchy patch. Sometimes it looks like dry skin or a small bump, but if it keeps itching, especially in the same place, and doesn't go away, it should be looked at under proper light by a dermatologist. Because the scalp isn't always easy to examine on your own, it's helpful to ask a spouse, caregiver, or hairdresser to check the area regularly. If you feel an itch that hasn't budged in weeks and it's not responding to anything you try, that's your sign to dig a little deeper, especially if you've also been feeling more tired than usual, more bruised, or just off in a way you can't explain. It might feel like a small thing, but sometimes it's the small, stubborn things that tell the biggest story. Sign 4. Localized itching on the chest or breast area. When older adults, especially women but also men, notice persistent itching on the chest or breast area, particularly around the nipple or just beneath the breast, it can be easy to attribute it to sweat, a snug shirt, or even age-related skin thinning. But this specific area is one of the most overlooked spots where itching may signal something far more serious: inflammatory breast cancer, or other underlying tumors near the chest wall. What makes this sign unique is that it often shows up before any lump does. The skin might feel warm, irritated, or tight. Sometimes there's a change in texture, slightly rough, thicker than normal, or with a reddish tint. But just as often, there's nothing to see. Only a deep, persistent itch that never seems to go away, no matter what cream or lotion is applied. I recall the story of Ruth, 69, who noticed an odd itching sensation around her right breast. She tried switching bras. She tried different detergents. She even went without a bra for a while, thinking it was friction. But the itching continued. Same spot, every day. When she finally went in for a checkup, her doctor noted slight skin dimpling and ordered further tests. What they found was a small but aggressive tumor growing close to the skin surface, without the typical round lump most people expect. This is one of the reasons inflammatory breast cancer can be so dangerous. It doesn't always follow the rules. It can mimic a skin rash. It can spread quickly. And the earliest symptom is often not pain, but irritation. That's why paying attention to itching that doesn't move around, doesn't ease with moisturizers, and is focused in the same place day after day is so crucial, especially in the breast or chest area. For men, this can be even easier to miss. Male breast cancer is rare, but it does happen and often goes undetected because the signs don't match what most men think to look for. An itchy patch near the nipple, a small area of thickened skin, or a persistent twinge of discomfort under the chest muscle might not sound dramatic. But for someone in their 60s, 70s, or 80s, it deserves a closer look. And there's more. This kind of itch isn't always about cancer growing in the breast itself. It can also be caused by enlarged lymph nodes under the arms or just below the collarbone, signaling lymphoma or another nearby malignancy. So if the itch is accompanied by swelling, warmth, or even just a vague sense of heaviness in the area, don't wait. Early detection doesn't start with fancy machines. It starts with awareness, with listening, with noticing the quiet patterns that seem out of place. Because your skin can't speak, but it can signal. And this is one of the most important signals not to ignore. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Sign 5. Persistent itching in the anal or genital area. There are few things more uncomfortable and more often ignored than itching in the anal or genital region. It's an awkward subject, especially for older adults, and many people would rather brush it off than bring it up. When itching in the anal or genital area becomes chronic, with no clear cause like hygiene issues, infection, or irritation, it could be your body's subtle way of signaling something much more serious. In some cases, persistent itching in this region may be an early warning sign of anal, vulvar, or even penile cancer. What makes this kind of itch particularly concerning is how easily it can be mistaken for something minor. Many people assume it's just dry skin, irritation from toilet paper, friction from walking, or a reaction to hygiene products or incontinence pads. Often, those assumptions are correct. But when the itch continues for weeks or months, when it keeps coming back despite every effort to soothe it, and when it starts to feel more like a raw or burning sensation rather than surface-level discomfort, it's time to take it seriously. Take Eugene, 76, for example. He believed he was dealing with hemorrhoid irritation for nearly a year. He tried everything: creams, dietary changes, even cold compresses, but nothing offered lasting relief. Finally, he saw a colorectal specialist. A scope exam revealed a small lesion on the wall of his anal canal. The diagnosis: an early-stage tumor. Something that would have kept growing quietly if he hadn't trusted his gut that something felt off. This isn't just an issue for men. Women can experience something similar. Vulvar cancer, though relatively rare, becomes more common after age 60. One of its earliest signs? A persistent itch on or near the external genital area. It might not come with a lump, but the skin can start to feel rough, thinner, or appear slightly discolored. Many women chalk this up to hormonal changes or postmenopausal dryness, and sometimes that's exactly what it is. But if the itch doesn't go away, worsens at night, and doesn't respond to creams or treatments, it shouldn't be ignored. This region of the body is full of sensitive nerve endings, which is exactly why it's capable of sending early signals of internal change, whether due to abnormal skin cell activity, inflammation, or swelling in nearby lymph nodes. A localized, persistent itch, especially on one side or in a specific spot, can be a red flag. Unfortunately, many people stay silent. They feel embarrassed or worry about making a fuss over nothing. But ignoring the signs is far more dangerous than voicing your concern. Saying something about an ongoing itch could lead to early detection, more effective treatment, and greater peace of mind. Here's the key takeaway. If the itch doesn't go away, don't assume it's harmless. Let a healthcare provider evaluate it. Often, detecting something serious, like cancer, starts with noticing something small and refusing to brush it aside. Final thoughts. As we wrap up this video, remember this one important truth. Your body is always trying to communicate. Sometimes it speaks through pain, sometimes through fatigue, but often the first signal is subtle, like a recurring itch that just won't go away. The 5 areas we discussed today, the lower legs, upper back, scalp, chest, and genital region, aren't chosen at random. These are the spots where certain cancers and internal conditions most commonly begin to whisper their warnings. And for older adults, recognizing those whispers early could make the difference between catching a problem soon or missing it until it becomes more serious. You don't need to live in fear. That's not the purpose of this message. The goal is to empower you, to help you trust your instincts and recognize that what seems like a small issue might be your body asking for attention. If any of these signs sound familiar, don't dismiss them. Talk to your doctor. Ask questions. Start the conversation, because you deserve answers, and you deserve to feel at ease. Thank you for spending your time with us today. We'd love to hear from you. Drop a comment below and tell us one thing you learned from this video and how it might impact your health choices. Your thoughts are valuable to us, and your feedback helps keep this community strong and informed. If you found this video helpful, please like, subscribe, and share. Your support allows us to keep producing content that educates, informs, and uplifts. Thanks again for watching. We'll see you in the next video.